Hey guys, it's Haley, Cosmetology 120 Lab, and today we are going to do application of the of artificial lashes. So to start with, we are going to greet our client. We're going to bring them back to our workspace, and we are going to look at their current style. Discuss with them any wishes or special needs that they may want, and then we are going to do a skin analysis. During the skin analysis, we're looking for skin that is inflamed, irritated, swollen, raised, bruised or broken skin, as well as wounds or open sores on the area to be treated today. And then we are also looking for infection and or infestation, such as head lice that would stop us from doing the service or keep us from safely performing the service. Then we are going to talk with the client about their consultation form that they completed. On the consultation form, we talk with the client about any medications that they've taken, or products they've used in the last 72 hours, as well as any known allergies that they may have. We also talk with the client about any facial surgeries they've had within the last 3 months, and if they are still under a physician's care for those. We would also discuss with the client about any we would discuss with them if they are prone to cold sores and or fever blisters. Also ask them if they have used any exfoliants or lightening agents in the last 72 hours. And that is your AHAs and your BHAs. And then lastly, ask them about any facial injections they've had, such as Botox or hyaluronic fillers in the last 3 weeks. If the client is free from all of those, then we would go ahead and start the service. So we're going to begin by washing our hands. So running hands under warm running water and lathering with antibacterial liquid soap. Then we are going to rinse our hands under warm running water, drying our hands with a disposable paper towel, turning off the water with the paper towel, and throwing the paper towel in the trash. At this point, we are going to use hand sanitizer. Hand sanitizer does have to be between 62 and 70% ethyl alcohol, and this one is 70% alcohol based. Dad's in there. So at this point, we're going to gather all of the items that we need for our application today. So first thing we need is gloves, and we're actually going to go ahead and put a pair of these on, but we're pretending, so because I only have a couple of pair in here. So putting on a pair of gloves. So putting on those, we're gloved. We have our gloves. We have our headband for our client. We have our drape, and we have our table paper. We have our cotton swabs, or not cotton swabs, cotton pads, I'm sorry. We have our scissors. And for the cotton swabs, I actually am using these because you don't use the cotton part, you use the stick part. So I have just, these are like wax applicators, but it's perfect because you're just using the tip. So I have those. And then I have two different pairs of tweezers. I haven't decided which one I like yet. I use both. This one is the one that's a little bit longer. I need my cleanser, oil-free makeup remover. I need a mascara wand, lash glue, tiny scissors. I don't know if I said these or not. Tiny scissors, and our lashes. So first thing I'm going to do is I'm gloved. I'm getting my barbicide wipes, and these are EPA registered, effective as a virucidal, fungicidal, and bactericidal agent. So the first wipe is cleansing and sanitizing our area and our cart, disposing of this in the trash, and allowing that to sit for 2 minutes. And we have wipe number 2, and this one is the actual disinfection. So wiping down our cart as well as this workspace. And then we're going to remove our gloves and dispose of them in the trash as well. And then we're going to set our bed. So this is our table paper. I help my client onto the bed here. Then laying down a drape. This is just protect the client's clothes. So at this point, we are going to wash our hands again. So beginning by running my hands under warm running water, applying antibacterial soap, and lathering. We're rinsing under warm running water. We're drying our hands with a paper towel, disposing of our paper towel in the trash, and then we are going to sanitize our hands with hand sanitizer. Hands are sanitized, and we are going to put on a pair of gloves. So we're pretending, but here's my gloves. So we've put on our gloves, and we are going to start our service. So the first thing we're going to do is cleanse the client's eyes. With our makeup remover. Then we're going to use our disposable mascara wand to just wipe the client's lashes, ensuring that they're nice and clean. And then we're going to dispose of this. Then we are going to open up our lashes. And we're going to measure these to the client's eye. And these are actually a little bit long. Trimming those, and then measuring. That looks like a better fit. And we're going to do the same thing on the other side. And again, this is a little bit long, so we're going to trim it. Dispose of this. Measure it one more time. That looks good. And then we're going to put our scissors in our to be disinfected. Then we're going to just a tiny amount on the end of my lid stick there. I don't know if you can, it's not zooming in, it's not. Disposing of that. I'm going just above the client's natural lash line. Put our tweezers to be disinfected. Dispose of all of our single-use items. And we're going to talk with our client about maintenance and aftercare. And then we are going to put our stuff to be laundered here. So all of that is to be laundered. We still have on our gloves, so we're going to go ahead and clean again. So we have wipe number 1, and we're using this to cleanse and sanitize our area and our cart. And then disposing of that in the trash. And then we have Barbicide wipe number 2. And this one is disinfecting the area, as well as our cart. Both of those allowed to sit for 2 minutes. And dispose of them in the trash. We're going to remove our gloves, dispose of them in the trash, and then we're going to wash our hands. So, wetting our hands under warm running water and lathering with liquid antibacterial soap. Rinsing our hands under warm running water. Drying our hands with a disposable paper towel. Turning off the water with the disposable paper towel and discarding that in the trash. And then we are hand sanitizing our hands with 70% ethyl alcohol.